Dr. Roy here. As we all know, navigating the world of periodontal therapy in the context of patients who refuse treatment can be troubling, challenging, and there's a lot of confusion that's out there. And what I wanted to do was to shed some light on it. We have our periodontal treatment consent and refusal form. Apologize, I'm battling a head cold. But this document has been shared with everybody. If you need a copy, just let me know. But what I did is I built something called the the red dot patient algorithm. This is more for an upset patient, but I think what ties into this is this Perio therapy refusal aspect to just difficult patients. So what I'm going to share here, I'm going to share in the framework of autonomy of licensed clinicians comes first. So I'm not forcing anybody to do this. This is the framework I feel comfortable with, and I want to present to the office as a tool. But you need to feel comfortable doing what you do. So if you're a hygienist working on one of these patients or a doctor that's brought into the room, do know the expectation is for you to be comfortable first, practice within your interpretations of standards of care, and loop me in when necessary. So where this came from, without a question, there are some patients we don't want around. And I have no problem dismissing those patients. As many of you know, over the past 5 to 10 years, I've kind of changed my tune on dismissing patients. And I think I've reached the point where I'm much more warm to the idea for the right situation. With that said, it's often used as a tool to avoid being better and acknowledging responsibility. And that's where I don't want the tool used inappropriately, but that's a topic for another day. What we have here is just a basic algorithm. Patient refuses treatment recommendation despite clear diagnosis and standard of care. Patient has periodontal disease, nobody's going to question that. Recommendation is for quasi-scaling root planing, referral to the periodontist for flap and debridement, so on and so forth. Now let's just say this patient is a good and respectful patient, the kind of person who you kind of want to bend the rules for, but you know you can't do that because the dental board won't allow us to do that. But let's just say a patient falls into that category. They also have a good reason to deny treatment. A 99-year-old with 3 7-millimeter pockets in one quadrant, and we're trying to push them to do scaling or root planing when they've had them there for 15 years. We need a tool to handle those kinds of patients. Patients who are in chemotherapy or terminally ill, or there's all kinds of situations where our heart goes out to the patient and kicking them to the curb and sending them to a practice that probably doesn't have the dedication to unique solutions like we do may not serve the patient well. So let's just say that patient exists. Well, I'd like to know about it. I think we should incorporate the doctors into having a conversation about, is this the kind of patient we want to keep in the practice? So we have two ways of approaching these, and I'm going to leave it up to the people interacting with these humans, these red dot kind of patients, to really give us a sense of what we should do, because they're the ones interacting with the patient. Again, we need to be comfortable in our execution of care. If the patient should be dismissed, please send me an email, detailed email on kind of what happened, what transpired, and I'm going to start kind of building these cases so that if they inevitably ever end up in front of the board, I have everything I need. And your detailed response there would be helpful. But if the patient falls into this category, they just don't have the finances, or they're at a certain age, we have the Perio refusal form. So you click here, and we have this form which we're hopefully all familiar with. If not, please become familiar with it. Keep in mind that this is a consent and refusal form. 98% of the time, it's a consent form. The other 2% of the time, it's a refusal to treat form. As we go through this document was put together through many conversations, many lectures, books on medical legal practices. And much of the guts from this actually comes from a malpractice insurance company. So I assure you that this is well thought out, very thorough, and very protective of our license in the eyes of the dental board or malpractice jury when it comes to practicing within the standards of care. Diagnosis, super important. I'm hoping every patient gets a diagnosis when it comes to periodontal disease. I feel like we do pretty well there. But where it comes down to patient refusal is this section here, risks of not having the recommended periodontal treatment. This is where I think supervised neglect gets a, let me see if I can phrase this right. Supervised neglect is a term that many people use and that they don't really understand it. To supervise somebody's neglect is only as true as how well informed the patient is for the ramifications, the risks of not doing treatment. And the problem is, most court cases that have to do with this, there's zero documentation whatsoever. So most dentists that are seeing these malpractice cases go through conclude, I should just dismiss patients that don't want to do the treatment. Well, the reality is, this majority of lawsuits that have led to this very quote-unquote sexy term of supervised neglect. I say sexy in the fact that whenever people use it, they always seem a little bit hyperfluent or exaggerated in a way that kind of bolsters the term itself. And I want us to be smarter than that, much more sophisticated than that. So if a patient is educated on all of the potential things, and if there's any here that we're missing, maybe even death goes in here somewhere, even death. The patient was educated, they made a decision, and we did our best in the confines of that. And I can't help but think kicking a patient to the curb, going to a practice that would treat them without going through this thoroughness is far worse off than staying in our practice and us educating the patient every year they come in. What are the pros and cons of not doing treatment? We have them sign this form. We put it the form. This is, the third time we've talked about this. The patient's fully aware of what they're signing up for. That's our duty. Our duty is to educate our patients, not to kick them to the curb. We can use a lot of medical analogies where a patient refuses cancer treatment. The cancer treatment doctors don't tell them to go somewhere else. It's just absurd. They educate the patient, they support the patient, they make sure they understand what their decision means, and they still care for the patient. There's no supervised neglect in that condition, to my knowledge, and if such a situation exists, I'm open to hearing that. So this is the area where we get to spend a lot of time covering our butts. And what I would do is actually go through all of these with the patient, have them sign it, add any other ones that might be there, and then at the end, you have them sign the refusal form. If they want to do treatment, as most patients would, you have them sign this here. So that's that. Please let me know what your thoughts are. I can assure you that many people are going to think this is crazy to keep any patient refusing perio therapy. I challenge you to challenge my reasoning here with factual data. As many of you know, I'm not a fan of I believe something because I learned it in school or my favorite instructor taught me it. That's great, that's a great start, but that's not necessarily something we want to hang our hat on. Where I see this being very powerful as more and more patients become just more emotional and more angry, we at least have a tool to help the patient that we want to help. So perio therapy refusal, opening this up for further conversation. If you don't have a full understanding of the perio refusal form, please let me know. And every patient that falls under this, I'd like to be looped in. So just shoot me an email, and we'll continue to build this out so that everybody feels comfortable with it. And it's a tool that we have in our back pocket and use with ease rather than being confused and frustrated whenever this arises. All right, hope all is well, and we'll talk to you all soon.